actually use it, proper procedures on how to cut it, how to activate it, place it, tension, those kind of things. But a lot of KT tape is just figuring it out yourself. I don't want to say that, but it's like, oh yeah, this is a full stretch, this is a minimal stretch, this is how we apply it, this is how you rub it on. So a lot of KT tape is just kind of playing with it, practicing with it, and get a feel for it. So when it's following like the exact instructions that are up in your proficiencies, so I do recommend at least someone at your table or your group has the proficiencies open, because you're going to have to kind of read through step by step to know what position to put your athlete in, or position that body part needs to be in. And sometimes you have to move their body part through a range of motion to apply it. I don't think it's so much of what we're doing today, but especially what we're going to be doing on Thursday. Okay, so make sure you have either your proficiencies out or a computer up or something so you can watch step-by-step type of thing. Okay, how many people are familiar with KT tape? Kind of, everybody's probably heard of it, everybody's probably seen it applied onto various athletes and everything. Probably most notably, Carrie Walsh from sand volleyball. A lot of times you see it applied on her whenever she's playing type of thing. KT tape is just one brand name of it. Obviously, this is not the brand name KT tape. This is some cheap, like I said, cheaper stuff that James found on Amazon and were able to get. But there's the two primary tapes we have is KT tape and Rock tape. So those are the two more name brand. A lot of times the more expensive it is, sometimes the better the elasticity is, or the adhesive I should talk about. The adhesive sticks better to the body, potentially lasts longer. I think I have used this, just try to test it out and use it on athlete. It might only last a couple of days, whereas sometimes with like the actual KT or the Rock tape will stay up to 5 or 7 days on the body. A lot of times it depends on where you place it on the body and how much friction it ends up having. We'll show, like today, I think we're doing some maybe an Achilles tendon facilitation. Obviously putting it on the bottom of the foot, you get a lot more friction from socks, from shoes, from moving, that it may not stay as well as compared to placing it like on someone's shoulder. Okay, they have movement, but there's not as much of that friction going on. And I think on Thursday we're doing a carpal tunnel with a buttonhole. So obviously hands, move it, gripping, grabbing onto stuff. Some of those ends might not stay as well compared to other places on your body. So always taking that into consideration. I'm going to read, so I do have an actual KT tape book, so I do keep this in my office. We don't use a lot of KT tape in the AT room. BG doesn't want to spend money to buy it. You'll find between all of the certifieds in the AT room varied thoughts on if they actually think KT tape works. I think it depends on the area. I think it also depends on the athlete, as we'll kind of warn too. It's based on your evaluative procedures that you do on the athlete and how you apply those. Okay, so those are the two main things that make sure if KT tape will actually work on the athlete. How you evaluated them for how you need to apply it, and then actually applying it correctly to the athlete. Okay? So like I said, we don't carry any of it. If I have an athlete that's like, hey, I really want to try this, or they came from the chiropractor or something, it's like, oh yeah, they applied it and I really like it, can we do it? We usually make them buy a roll of KT tape, bring it in, and we'll apply it to make sure that it's actually getting applied correctly and doing what it's supposed to do for the athlete. But like I said, we don't really typically spend the money, but this is a good introductory course for it. You can get certified in either KT tape or Rock tape to be certified to apply tape. You go a lot deeper into the theories behind it, why you apply it, how you apply it. Like I said, this is just going to be super superficial, covered it so you guys get recognized to the tape, how to apply different things. Like I said, I do have a book here, so if I do have an individual that comes with something particular, I can look up her body part of whatever it might be. That'll give me a better step-by-step instructions how to apply it for whatever instance I'm going to apply it for. Okay. Otherwise, you can go onto YouTube and type in KT tape for quad strain. It'll bring up 20 videos for you. Okay, take those with a grain of salt. Once again, you need to know personally, you need to know your anatomy, the functioning of the muscle, what you're applying it for, like why you're applying it, and to make sure you're applying it correctly. Okay, so a lot of this, like I said, super introductory now, but once you get into more of your evaluation and assessment class, you get a little bit more understanding of what's wrong with either the muscular joint and then what you need to do to correct it. Okay. So if you take a look at our KT tape, if you guys want to kind of peel off just an edge or cut a piece of tape, so you can kind of see it does have some flexibility longitudinally, but it does not stretch widthwise. Okay, and then it does have like a weave texture that goes through it. So majority of the point of KT tape is to lift the skin up and to allow passage of fluid underneath the skin and through our superficial lymphatic vessels. Okay, it can also be used to create muscle function or inhibit muscle function. So once again, you have an injury, you decide, oh, do I need to help move the muscle or do I need to inhibit the muscular motion? Okay. It also works on a slight neural function where with the grooves in there also helps with the neural pathways between the muscular body and to the brain on how the muscle should function or not muscle should flow. Okay. The wave pattern in the actual tape was developed to mimic fingers or like a finger motion to help accentuate like our more of a manual therapy onto a shoulder or onto our muscle, I guess. So the wave is supposed to mimic more fingerprints or and also mimic more of a hand placement on the body to help neural functionally place them in the correct position or neural functionally help the muscle react in the correct direction type of thing. Okay. K-tape is obviously different from our typical static white tape. When we're applying white tape, say to an ankle, we're trying to prevent some type of motion, correct? Even when we're placing it to our wrists, our white tape is a static, it's a hard, and we're trying to prevent either flexion or extension or whichever it might be. K-tape is allowed in throughout our healing process. So it's for lymphatic drainage, which we'll learn with the ankle to try and pull swelling out of the area. It can help facilitate, so activate muscles and move it correctly, or it could inhibit musculature movement like we would typically use with a white tape. Okay, so that's kind of the theory or purpose behind K-tape is that we can use it from initial acute injury all the way through basically return to play processes, right? The tape itself is also supposed to mimic the surface of our skin or epidermis. It is developed so the thickness of the tape is also about the thickness of your epidermis. It can stretch about 40 to 60%, which is about what your skin should be able to present to, or 40%, 60% of a stretch tensile elasticity. Does that kind of make sense? So whenever you just lay, this kind of gets into a little bit of application too. But when you just lay a tape down, it automatically has about a 10 to 15% stretch on it already. So even if you want to go through your processes and look at your different places where you need to lay it, if it just says laying down, there's still a tension to it. Okay, so about 10 to 15. Then when it starts to ask you to start pulling it, so as you can kind of see, and you can also see the waves rolling through it on your little piece. The most effective portion is usually a 40 to 60% stretch tensile to it, because then it mimics, once again, the stretching of your skin or your epidermis. Yeah. Different ways to apply it then. So obviously you need to kind of measure out your area, just like when we do with either our moleskin or our McConnell tape. Yes, thank you. Our Leukotape. Yep, to our Leukotape, we need to kind of measure it out. But know that if you have tension and you're going to pull it, it's going to cover more distance. So if you know there's going to be some good tension, you're going to pull it a distance, you can always cut it a little bit shorter type of thing. Anytime you cut it, we recommend that you cut it into like a semicircle. So we cut off those corners. So obviously it comes off with squared edges. squared edges tend to get pulled, get picked, and can start pulling off sooner. So by rounding our edges, then we're able to have a lesser option for it to get picked and pulled, all those kind of things. It is heat activated. Okay, so anytime I place it on, this is an example of just an I strip. You also have Y strips where you cut it down the middle and it splits. You can make a webbing, like I said, our lymphatic system, which we'll do for our ankle. Basically, you make strips coming across it. I say a lot of these you won't end up doing. And they also have an X strip too, where we cut it. Once again, it's depending on where we're placing it on the body and what we're wanting to do with the function. Okay, but either way, it's heat activated. So a lot of times before I even place it, I kind of rub it a little bit to start activating it. We have our anchor point, which a lot of times we place on the skin, gently peel back the tape, and we can go ahead and stretch to wherever we need, and then you place your base on again too. Okay. And then once it's on the body, once again, you go ahead and rub it on it to activate the heat. Usually it takes about 20 to 30 minutes for it to fully get, for the glue adhesive to fully get activated. So if you have an athlete that's running out to practice, you typically don't want to put it on right before practice because they'll get too much sweat buildup and then they'll fall off. Okay, so you either need to do it in the morning or give yourself half hour, even to an hour of time for that adhesive to fully get activated before they go and do excess activity. Okay. Biggest thing too is you want to minimize the amount of times you are touching the adhesiveness. So as I place the anchor on, I don't want to be constantly touching the adhesive because it's not going to stick to your skin very well or to the athlete's skin. When applying it, you need to prep the skin too. You want clean, dry skin. Okay, so a lot of times we take our alcohol pad, make sure we clean it off. If you have someone that's excessively hairy, more than likely you're going to recommend them to shave. Okay, I've seen this, if we're putting it on knees, if we're putting it on ankles type of thing, it's not going to stick if there's a lot of hair on the body. So you're going to want to shave it and then make sure it's clean every time you place it. Let's see here. Made notes so I didn't forget anything. So obviously if somebody can shower, can swim with this on, always make sure you tell them to never rub it. So if you're drying off, don't take your towel and rub over top. Try and pat dry it so it doesn't roll up. If it's only been on for a couple of days and you start getting kind of rolled on the edges or whatever, you can trim them off until you feel like that it's not getting its actual effectiveness going on right away. Okay. Trying to think any other ways to properly apply it that I'm missing. Okay. So going from my book, I just want to say different ways that KT tape is supposed to help you is an assist in normal circulation or a lymphatic flow. Big thing we'll talk about when we do our ankle. Supposed to help decrease our pain, assist with muscle function. It affects fascial tissue and it helps improve joint function. Okay, once again, it all goes into your assessment capabilities and assessing what's wrong with the athlete and then being able to properly apply it. One of the big things is really good to know is if you're doing muscle facilitation or muscle inhibition. Okay, so if you have a muscle strain, so you guys are pretending that this is our bicep. Okay, so this is our shoulder up here, and this is our elbow down here. Anatomy is going to come into play a lot of times when you're evaluating, which is in general, and then when you're applying your tape for any position. Okay, so obviously our biceps originate up at our shoulder, and it inserts our elbow. Our function is flexion, right? So it helps flex the elbow. So anytime you have an acute injury, you have some swelling in there, you want to help the muscle kind of rest. So we're basically going to apply it from insertion to origin. Okay, so we're going to pull up on the muscle because say we have a little strain or a little tear in there. We want the muscle to be able to rest. So this is helping with pain management and it's helping the muscle still facilitate, but in a lesser portion to allow this little strain to heal. Okay. if we had this bicep strain, all of a sudden it's healing, yeah, there might be a little bit of scar tissue on there, but you're finding that we're still having some issues, still having not quite too much pain, but now that we're far enough out, we're then going to attach it opposite. So then we're going to go from origin, to insertion, because now we're trying to help facilitate and making sure that muscle activates and works properly, even though it's still probably a little weak from having that strain on there. Okay. Last one I want to kind of show, so that's just using our basic Y strip on there, which I think we'll have. I think another one we'll use is our, that's just an I strip. We'll also use a Y strip, I think Thursday, when we do a patellofemoral or patellar tendonitis type issues. The other one I want to talk about today is our lymphatic system. Bear with me, this is going to be I'm trying to decide how I should even draw this up. So this is going to be your ankle. Okay. I didn't want to draw the bones. So this is the outside of our ankle. And this is the one that I have found that our KT tape is most effective, is our lymphatic drainage, or lymphatic drainage systems. So say we have somebody that has an acute ankle sprain, and this is that's our malleolus, okay? So now we have this ankle super swollen. We have to try and get that swelling out of there. Otherwise, obviously we know other means. So we know our horseshoe and wrap. We can get them on crutches. We can put them in a boot. We have other machines downstairs. So we have the compression boots. We have the Game Ready. So we have all those options to help us try and get that swelling out of there. We can also use manual effleurage massage to try and get that swelling out of there. But this is one other way. So if they're walking around campus all day long and they feel like, oh yeah, I get really good, I can get this swelling out of there between my Game Ready, between my massage, all of a sudden they get coming back from a long day of walking around the classes, swells up again. So lymphatic taping is a way that's going to also help pull the swelling out of there throughout the day. Okay, so this is when we're going to use our, so imagine this is our KT tape. So we're going to cut it in strips. I'm going to cut one. Let's see, yeah, whatever. Okay, so we have 1, 2, 3, 4 strips, but we never cut all the way down because we need an anchor space, right? So we're going to place our anchor here. Now as you will be able to see from your picture, and we're going to take those strips and wrap it around the ankle to where all of that swelling might be. So it's going to use our own lymphatic system and basically take our strips as ports to take that swelling, pull it out of the ankle, and pull it back up into the foot. Okay? Like I said, this is the one I will actually use most commonly, either for ankle and especially for knee, where you typically see the most swelling occurring. I know the book, wherever, I don't remember where you even pulled this.
Out of the textbook.
Out of the textbook, okay. I'm not super impressed with how low they start with where they place our anchor strip. I would actually prefer their anchor strip to be a little higher up the foot. Because if we're pulling swelling out, that's going to go, our swelling gets pulled from the ports into our ankle. So obviously you see here, we're not really pulling it out of the ankle. We're just pulling it out of the foot into the ankle. So obviously you kind of see where your swelling is gathering. If your swelling is gathering more in the ankle mortise, you're going to want to take this anchor and put it a little bit further up the leg. If you have someone broke their foot and they're having more swelling within the actual one of the metatarsals, then this might be okay, because then our swelling is gathering more into that midfoot. But if we have true ankle swelling, you're going to want to put that anchor just a little further up the leg to be able to pull it out of the ankle. Make sense? So obviously this is our lateral side. We're going to see how this is going to turn out. Okay, so this is our lateral, this is our medial. So we're going to be placing 2 strips on it. Sorry if you guys can't see. So this guy's going to lateral. So then we're also going to have another one on the medial that's going to kind of wrap around the foot. And I have tried various techniques too, where I'll place on both sides. I'll put the anchors and then I'll kind of overlap my two sides. If that makes sense. I know the book kind of shows you go ahead and lay your entire lateral side first, and then go ahead and lay your entire medial side. You can try it. Have I seen a really true difference when I've worked on my athletes? Not really. But I think sometimes doing like a weave pattern is going to pick up more fluid and pull it out. So if you got an athlete that they have swelling, you can try intermixing them together, or you can just try laying them on top of each other. So that's kind of just one of those experimental type things that you can do. Super brief overview of what KT tape is and what it actually does. Okay. But like I said, the purpose of this class is go ahead and get your hands on it, follow along, go ahead and practice. Like I said, your tension that you're going to pull for like the lymphatic system is going to be different than the tension you're going to pull for your Achilles facilitation. Okay, makes sense? So that's why we need to kind of read step by step. Helps you practice on your anatomy, your origins, insertions, and actions. Yeah, any immediate questions? And I'll kind of follow around. I'll help you, if you've got questions, I'll help you lay it down or show you how to kind of lay down and everything too. Biggest thing is learning how to cut it, the length you need to cut it. And I know the scissors we have in here aren't the greatest, so be a little patient with them and trying to actually cut through, especially if you're cutting your weave pattern. What's nice about these, there's a nice little grid on the back paper, so you can cut along your grid and try and get semi-straight cut lines. That makes sense? All right, have two. So obviously today we don't have